There are millions of people who receive a diagnosis of cancer each year, and the numbers continue to rise. A great number of cancers, such as pancreatic or brain cancer, do not show any symptoms until it is too late. To tell you the truth, however, early discovery can be the deciding factor in whether or not a person lives or dies. By identifying the symptoms of cancer before it has progressed, the likelihood of a successful therapy can be significantly increased. When you look for information online, you could be thinking something like, "Every little symptom sounds like cancer." I know what you're thinking. That is precisely the reason why this video is not like others. The purpose of this article is to provide you with genuine, scientifically established warning signals that have assisted thousands of people in detecting cancer at an earlier stage, when it is most curable. There is no way to overlook the significance of your health. Number 1. Pain in the bones. Pain in the bones that does not go away is easily one of the most disregarded indicators of possible malignancy. Cancer-related bone pain often develops over time and frequently gets worse at night, in contrast to the brief discomfort that can be caused by activity or small accidents. An intense, piercing pain that is difficult to ignore is the result of cancer that starts in the bones or that has progressed to the bones. This causes the natural structure of bone tissue to be disrupted. When it comes to primary bone cancer, sometimes referred to as osteosarcoma in the medical field, the long bones in the arms and legs are frequently affected. When it first begins, the pain may be mild and resemble a sprain or a muscular ache. However, as time passes, the discomfort progressively gets more intense and persistent. The fact that this might have an impact on your day-to-day activities, making even elementary motions more challenging, is one of the most troubling aspects of this situation. A number of individuals have reported that the feeling is characterized by a throbbing or aching sensation that does not react to conventional pain medications. It is imperative that you get medical assistance as soon as possible if you experience bone pain that is accompanied by swelling, increasing soreness, or fractures that for some reason cannot be explained. There is a considerable improvement in treatment results when bone cancer is detected at an early stage, with survival rates being much greater when the disease is discovered at an earlier stage. Number 2. A persistent cough or hoarseness go away. You have been struggling with a cough that simply won't go away, have you? The presence of a persistent cough or hoarseness that lasts for more than 2 weeks should prompt a medical professional to examine the patient. The presence of a hacking cough that is dry and does not improve with time may be an indication that you have lung cancer. Having a cough that produces blood or a discharge that is bloody is a very serious symptom that requires quick medical treatment. There is also the possibility that you are experiencing hoarseness or a raspy, strained voice that does not go away. Observing alterations in your voice, particularly if they are accompanied by difficulties swallowing or pain in your neck or throat, may be an indication that you are suffering from cancer of the thyroid or the throat. It is common practice to disregard persistent coughing and hoarseness as insignificant side effects. However, if these symptoms continue for an extended period of time, they may be an indication of more serious diseases. An example, lung cancer can be the cause of persistent coughing that does not respond to the therapy that is typically administered. Do not disregard chronic respiratory problems and pay attention to what your body is telling you. You should seek the advice of a medical professional if you have a cough or hoarseness that has persisted for more than 2 weeks in order to ascertain the underlying reason and the therapy that is most suitable for you. Number 3. Persistent fever. Your body may be trying to tell you that you have blood cancer if you have a fever that will not go away or that keeps coming back. Cancer-related fevers frequently follow a particular pattern and may be accompanied by other systemic symptoms. This is in contrast to the ordinary fevers that vanish after a few days. If you have leukemia or lymphoma, your immune system may be triggered to release substances known as cytokines, which can result in recurrent fevers. Other symptoms, such as night sweats or unexplained weight loss, are frequently present in conjunction with these fevers, which may occur even in the absence of any obvious illness. It is possible that the pattern will include cyclic fever, which is characterized by temperature rises at regular intervals. An inquiry by a medical professional is required when a fever lasts for more than 2 weeks or whenever it comes back regularly without a discernible reason. If you have blood cancer, your immune system may be compromised, which will make you more susceptible to infections. Additionally, blood malignancies can directly cause fever. In the course of a proper examination, blood tests are frequently performed in order to look for aberrant cell counts and other indicators of illness. Number 4. Fatigue that does not go away. Are you experiencing particularly high levels of fatigue as of late? One of the early indicators that cancer is forming in your body is persistent weariness, which might be a marker of the disease. When you become aware that your levels of energy have decreased and that no amount of sleep or rest appears to be of any assistance, it is time to pay attention to the situation. It is not the typical fatigue that comes from a busy day. Rather, it is a profound and relentless exhaustion. It is possible for cancer to cause a persistent feeling of fatigue in addition to other symptoms that are associated with it when it interferes with the natural activities of your body. But here's the tough part. Persistent exhaustion is sometimes confused with stress or overwork. This is a common misconception. But if you discover that you have been experiencing exceptionally high levels of fatigue for an extended length of time, it is imperative that you seek medical attention. To identify whether or not there is an underlying problem that has to be addressed, they are able to carry out the essential tests. Cancer can present itself in a variety of surprising ways. Nevertheless, understanding the warning signals at an early stage might result in a significant difference. Your body has a way of letting you know when something isn't quite right. You shouldn't disregard this signal. It is possible that paying attention to these symptoms is the first step toward early identification and treatment that might save a significant amount of life. Number 5. Eye pain. Your eyes have the ability to provide vital information about your general health, including possible indications of cancer within your body. Even though it is uncommon, ocular melanoma is the major eye cancer that may be found in the most adults. Sometimes the symptoms start off in a subtle manner, but they can eventually become more visible and should not be ignored. It is possible for cancer to form in the eye, which can result in a variety of symptoms that are unique from those that are often associated with eye troubles. You can suffer hazy vision that does not improve with new glasses, or you might see unusual flashes of light that cannot be explained by migraines. Both of these symptoms are possible during migraines. When a black patch appears on the iris and progressively changes in size or color, this is the most alarming indicator that may be observed. The detection of these alterations can be aided by the utilization of advanced imaging techniques such as ophthalmoscopy or colored imaging. The likelihood of developing ocular melanoma is increased in those who have light-colored eyes or fair skin. It is important not to disregard any changes in vision or chronic eye discomfort. The preservation of your vision and your life can be accomplished with early intervention. When you have risk factors, such as extended sun exposure or a family history of eye cancer, seeing your eye doctor on a regular basis becomes very crucial. Number 6. Persistent heartburn. GERD, which stands for gastroesophageal reflux disease, is a medical condition that causes chronic heartburn. It may appear to be nothing more than a nuisance. However, if it continues to occur after changes in lifestyle and the use of medicine, it may be an indication of something more dangerous. Esophageal cancer frequently presents up first as a chronic acid reflux that does not respond to the therapies that are typically used. Repeated damage to the lining of the esophagus is the cause of the connection between persistent heartburn and the development of cancer. A disorder known as Barrett's esophagus can develop as a result of alterations in the cells that line your esophagus that are brought on by stomach acid over time. Your chance of acquiring esophageal adenocarcinoma is greatly increased on account of this precancerous disease. When you have heartburn, you should also be on the lookout for warning symptoms such as trouble swallowing, food becoming stuck, or weight loss that cannot be explained. It is time to seek the advice of a medical professional if you have been using over-the-counter drugs to treat heartburn for more than 3 weeks without seeing any improvement in your condition. Number 7. Excessive bruising. When you least expect it, have you found yourself with bruises? In certain cases, some blood malignancies might be identified by the presence of excessive bruising in unexpected locations on the body. It is imperative that you seek medical attention if you see the appearance of bruises for which there is no obvious explanation. You may have a problem with your blood cells, such as leukemia, if you get these kinds of bruises. The inability of your body to create healthy blood cells is one of the indications of leukemia, which also causes symptoms such as unusually heavy bruises. It is possible that you will find bruises on your arms, legs, or other places of your body where you would not normally anticipate seeing them. Due to the fact that it may be an early indicator of a more serious ailment, this symptom should not be disregarded. There is a possibility that you will experience other symptoms in addition to bruises, such as frequent nosebleeds or bleeding gums. It is also possible that these are indications of blood problems or malignancies. When you encounter any of these symptoms, it is imperative that you get medical attention from a professional in the field of medicine. Take note of any changes that occur in your body, particularly any bruises that cannot be explained. Make an appointment with a medical professional if you find that bruises are occurring regularly in locations that are not typical. When detected at an earlier stage, it can have a major impact on both the therapy and the results. Have you found this video helpful? Please click the like button and subscribe to our channel so that you may watch further helpful videos that are similar to this one. Our goal is to ensure that you are healthy, so thank you for watching.